a number of studies suggesting women who are pregnant and get COVID, especially in the third trimester, are more likely to be intubated, need mechanical ventilation, have ICU stays, and in some countries as well, increased risk of death.
With the fourth wave of COVID upon us, one Calgary OBGYN is calling on all pregnant persons to get vaccinated. Across Alberta during the pandemic, Dr. Stephanie Cooper says roughly 18 pregnant or postpartum people with COVID have been admitted to the ICU.
Before COVID, outside of obstetrical hemorrhage, someone being admitted to the ICU in pregnancy was very unusual.
Cooper says treating COVID in a pregnant person is incredibly complex.
We also have to think that there's a baby there, so we have to think, what are these medications that the baby is going to get? How does a position that may be needed to help a mom breathe better, how is that going to potentially impact a baby?
Data out of the University of BC shows not only an increase in risk for adverse outcomes for COVID during pregnancy, it shows an increased frequency of preterm births.
Depending on how early it is, that can have significant long-term health consequences for a baby.
At the start of the pandemic, Cooper says most physicians were suggesting the vaccine to pregnant people and were supportive to those who chose not to.
A lot of us have moved to say we're no longer just discussing it, we are recommending it. And this has been something that has been definitely supported by major pregnancy associations around the world because emerging more and more data is coming out that there is no increased risk of complications for babies, whose moms have had the COVID vaccine.
In Calgary, Tara Overholt, City News.